morning, everybody. Melissa here from Clinical Education. I am here today to talk about masks. Oh boy, lots of masks, lots of things going on with masks. So this is what we're calling masks demystified. Remember the day when we used to wear these Pillow Soft level 3 surgical masks and complained? Well, guess what? Those days are over. No more level 3 surgical masks. We have switched to the Halyard N95 duckbill mask. And the reason we switched to this is a thing called source control. What we mean by source control is we don't want you to be the source of anybody to get COVID. And so the Halyard N95 offers a higher level of protection from you giving anyone else COVID. And so you're not going to be the source of the infection. And how that Halyard works is when you take it out, it's got these two rubber thingies that are gonna fall out, and you basically make a nice hole for your nose there, and you're gonna stretch the two rubber thingies over your head like this, pinch around your nose, and you're gonna put one of the rubber thingies at the base of your neck here, and the other one's gonna come up here to the top of your head. And then when you're done doing that, you're gonna slowly press against your face to make sure it's got a nice seal. And then the final check is breathing in and breathing out to make sure you've got a nice seal. And that is going to prevent you from being the source of somebody else's infection, basically. Where it gets confusing is people are confusing this with a fitted N95, which this can be a fitted N95. So if you have gone down for your fit testing and this is the mask that they fit test you for, you can then wear this as an N95 as well as just source protection. However, if you were fitted to one of these masks, these N95s, and you are now going to be participating in a patient's care that includes aerosol generating procedures, which could include CPR, intubation, giving a med-neb, BiPAP, CPAP, trach suctioning, then you will need to take this mask off if this is not your fitted N95, and switch out to the N95 that you were fit tested for. This will now provide you the protection you need from getting COVID or some other infectious disease while that procedure is happening, the AGP. Once the AGP is over, you can then take this off and put your Halyard N95 on. So basically, this is a replacement for this. I know this gets confusing, but this can also be your fitted N95 if this is what you were fitted to, or you will need to switch out to the N95 you were fitted to if the care you were giving requires a fitted N95. Now, we're gonna add one more layer to this. If you are not working in a COVID unit and you cannot wear an N95 because some sort of facial thing that you can't fit to an N95, I don't know, many reasons, you will have to wear a PAPR or a capper. If that is the case, we now want you to keep your duckbill, your mask on, and put your PAPR over top of this mask. That is again for source control. We don't want you to be the source of air escaping that PAPR onto a patient who does not have COVID. So this mask is going to prevent that patient from that air escaping from that PAPR and giving them COVID. If you're working on a COVID unit and you're wearing a PAPR, you do not need to wear the mask because all the patients unfortunately already have COVID. So this is only on units that are not COVID positive, with patients that are not COVID positive, that you need, when you're putting on a PAPR, to wear this mask properly underneath of the PAPR. And then once the care is done, you can take the PAPR off and move on with your care for your other patients. I hope this brings some clarity, this mask confusion, and masks are now demystified. Please reach out if you have any questions to your education team or your employee health team. Thank you very much.